So as we said that there are many options available to the physicians to treat patients of diabetes mellitus. Many options, like for example oral medication tablets, for the physicians to pick and choose based on all the factors that we have mentioned earlier: the patient's age, body weight, hereditary factors, lifestyle, whether there are any other conditions affecting other organs available, present at that particular time. So amongst all these agents, the gliptins are a new group of drugs. They have been in use very recently, but because of their efficacy and because of their safety, as we mentioned earlier, that these are weight neutral agents and they do not cause a very significant drop in the blood sugar level, which can affect the patient's life. So these drugs are being used very commonly nowadays, not only in India but across the globe. Now let's come to see how these drugs act, or how vildagliptin acts. So vildagliptin and the other agents in this group, they act by reducing the amount of an enzyme called DPP4, which is dipeptidyl peptidase 4. It's an enzyme. We have all learned in our chemistry classes in school and college that it's a chemical substance which does not take part in the process but facilitates the process. So as a result of the inhibition of this enzyme, what happens is the end result is that the pancreas, which is an organ which is important for controlling the blood sugar levels, releases more insulin in the blood in response to high sugar levels that are there in the body, and thereby it reduces the levels of sugar that have gone high in the blood. So these drugs act by increasing the amount of incretins we have, as we mentioned earlier. So they act around the chemical substance called that incretin. So this elevated incretins then go and tell or stimulate or ask the pancreas to release more or secrete more amount of insulin, so that the elevated blood sugar levels can then be effectively controlled. So now if we talk about vildagliptin. Vildagliptin was first synthesized or manufactured or made available in the year 1998. And as mentioned earlier, it will increase the amount of incretins and then thereby increasing the amount of insulin that is secreted by the pancreas.